That's what we have to say, because you're a professional.
All right, so the eye, think of rectus, because the rectus is a major muscle that's going to move the eye. We have the superior rectus, which is where you expect it, right, on the superior position. We have the inferior rectus. We have the lateral, it's on the lateral side, and we have the medial, because this is the nose, so the medial rectus right there. So just think rectus, and you got four muscles to choose from. Superior, inferior, lateral, medial.
Rectus is straight line, correct?
Yes, thank you. Well done. We also have an oblique muscle that's kind of hard to see, but the oblique down here is a muscle that's going to turn the eye. So we have a inferior, and the superior oblique doesn't show up on this model, but you would expect it to be right in here. But you can see down there inferior oblique to turn the eye. We also have a levator palpebrae. Okay, so here's the superior rectus here, and on top of it is that muscle that's going to come around and lift the eyelid. We saw this in the cadaver. Levator because it lifts, palpebrae superioris, right there on top of the rectus superior. Okay, that's the eye. For the face, I'm going to use two models because this one shows the muscles of the zygomaticus. You have coming down here, think of the zygomatic bone. You have the zygomaticus minor, zygomaticus major, coming in just like that. Below the zygomaticus major is this muscle, the risorius, that's going to pull on the mouth. So risorius here. So zygomaticus minor, major, risorius here. In front, or superior to the zygomaticus minor, is this levator muscle. And there's different levators. This one is going to lift the lips. The technical word for lips is labii. So levator, labii superioris. So it's in the superior position, pulls up on the lips, it kind of exposes the teeth. Talking about labii, we have the depressor labii inferioris, because it depresses the lips downward. So depressor labii inferioris, levator labii superioris. Okay, so see, these have opposing actions. That way it's kind of easy to remember. There's the mentalis, which is about where the mental foramen is. Angle of the mouth, think of mouth meaning oris. So depressor anguli oris. So it depresses the angle of the mouth down. And you can see where that muscle is. When it shortens, it's going to bring it down to a frown. Speaking of oris, this is the orbicularis oris. So we have these circular muscles. It's kind of weird to have a muscle that like attaches to itself. It's not very common in the body. This is the kissing muscle, orbicularis oris. And here's another circular muscle attaches to itself. Because see, most muscles attach to a bone. These attach themselves. Orbicularis oculi. Okay, so those are the two orbicularis muscles. Deep in here is the buccinator. Helps with that blowing action. Buccinator is deep to the risorius zygomaticus muscles. Here, the muscle, as you would expect, this is a nasal bone, so it must be the nasal nasalis coming across. There's the levator labii superioris, the same one I covered on the eye. So that levator is going to lift the eyelid up. Here's a jagged muscle. Think of corrugated muscle, corrugator superioris, coming up like an eyebrow. Supercilii, excuse me, corrugator supercilii, coming up like that. Masseter is that huge chewing muscle. Think of mastication or chewing food. Masseter on both sides. While we're on the side, there's the temporalis, right where you expect it to be, where the temporal bone is. And here's the mastoid bone on the, mastoid process on the occipital. And that's an important attachment site for the neck muscle. So we go sterno, because the sternum is less movable, so that's the first part of the name. Sterno, it passes the clavicle, clido, and here it attaches mastoid. Sternocleidomastoid, huge muscle of the neck. Occipital frontalis, here, aponeurosis, where it becomes cartilaginous. I think we got it. Yeah. Okay, which one of these guys would you